So our next speaker is Miriam Asia. Miriam Asia is a senior endocrine specialist nurse at the University Hospital NHS Foundation Trust based at Queen Elizabeth Hospital in Birmingham. She finished her bachelor's and master's degree in nursing at St. Paul's University in the Philippines. She's an independent nurse prescriber. She has completed the Society for Endocrinology master's module in endocrinology. She runs the twice-weekly Adrenal tumor nurse-led clinics and the weekly thyroid nurse-led clinic. She has participated at various research studies conducted locally and internationally regarding adrenal tumors and works within the largest adrenal tumor services in UK, which has been awarded ENCAT Centre of Excellence. She's a member of the board of trustees of the Patient Support Group. She's just finished her term as a nurse committee member of the Society for Endocrinology and now newly elected nurse member for the European Society of Endocrinology. So welcome, Miriam.
Good evening, everyone. My name is Miriam Asia, Senior Clinical Nurse Specialist in Endocrinology at the University Hospitals Birmingham NHS Foundation Trust, based at Queen Elizabeth Hospital, Birmingham in the United Kingdom. Many thanks to the European Society of Endocrinology Nurse Committee for inviting me to talk to you today regarding benign adrenal tumors utilizing the nurse competency framework. So the outline of my talk involves overview of the SFE competency framework, utilizing the competency framework, supporting evidences of competency, and support needed to achieve the competency. So the Society for Endocrinology Competency Framework for Adult Endocrine Nursing 2nd edition was developed by a working group of UK endocrine specialist nurses and the Society for Endocrinology to enhance the clinical care that adults with an endocrine disorder receive. This focuses on the knowledge, skills, and intervention relevant to nurses looking after adult patients with endocrine conditions. So there are several benefits regarding this competency, not just for us endocrine nurses, but it benefits our employers as well as the patients and the public that we are caring for. Utilizing the competency framework. So how does this work? So this focuses on the skills and knowledge of the endocrine nurse in order to achieve competency to become an adult endocrine nurse. And these are the ways on how we can utilize the competency framework. First is the SWOT analysis, or what we call strength, weaknesses, opportunities, and strength. Strength means to say that this is what we are able to do now. We have achieved our competency and we are confident in doing these activities or procedures. Weaknesses are what we still need in lacking, what we still need to achieve, what we still need to learn, and what we still need to hone better. Opportunities are, for example, available audits in order for us to build or set up a nurse-led clinic. What are the evidences for us in order for us to do this? Opportunities to attend conferences, opportunities to attend meetings, opportunities to network with other nurses. Threats are like constraints or restraints that would be a hindrance, possible hindrance for us to achieve these competencies, which we need to be able to identify. Another one that we can utilize using the competency framework is setting up or agreeing a learning contract or outcome with either your mentor or your manager with a definitive time frame. This will enable you to be given protected time to study, to attend university, for example, do your audit, or attend conferences and meetings. Another way to utilize the competency is through mentee and mentor relationship, which this can be done through virtual meetings via Zoom or MS Teams, especially if you're a lone worker or with a senior staff where you are currently working, who's an expert into the competency that you are working on. And another way to use the competency or utilize the competency is through appraisal or progress review. In this way, you will be able to look at what other needs that you need to identify, or what have you achieved, what are your future objectives, or what if you have achieved your objectives, how are you going to improve this? And this can be done as we all do every year. We look at our appraisal or what we call our performance development. Last but not the least is through mapping of learning needs and identify current level of competencies. By looking at the competency framework, we will be able to identify exactly what we want to achieve. For example, there are 13 competencies in the competency framework. You're not expected to become an expert to all of these competencies. You can pick and choose whichever is applicable to you. For example, what we are going to be discussing today is the competency number 2, which is the benign adrenal tumors. Then you can work on the other competencies after that. Okay. So as I mentioned, our focus today is benign adrenal tumors, which is competency number 2. And because we know adrenal tumors or adrenal gland is a hormone factory gland, and it's part of our role to investigate if it's a functioning or a non-functioning lesion. And part of that is doing testing. So being competent to look after benign adrenal tumors, we can look at competency number 4, which is endocrine dynamic function test, which we will discuss very briefly later as we go along in my talk. So this is competency number 2, benign adrenal tumors. These are the criteria and things that can help us achieve our competency to become competent, proficient, and expert. And we are going to look at this specifically from each category. For that, we need to look at the 4 pillars, which is clinical practice, leadership and management, education, and research. Now, I mentioned that we are going to be focusing just mainly on the 2nd edition of the competency framework. But we are aware that the 3rd edition is on its way, which is now based on the Benner's novice to expert theory that we will be starting to look at our junior staff from the novice, which are the non-registered staff from bands 3 to 4, and then the advanced beginner, bands 4 to 5. But for the purpose of this talk, I'll be discussing only basing from the 2nd edition, competent, proficient, and expert. Okay, so these are the criteria in order to become competent in the benign adrenal tumor competency. And we'll just get one example from this, and you can look at how we can manage to achieve this competency. First, demonstrate an understanding of the anatomy, physiology, and normal functioning of the adrenal glands. We are aware where the adrenal glands are, okay? We know how it's function. We know that the cortex produces steroids. We know that the medulla produces adrenaline-type hormones. And we need to be able to demonstrate that we understand this fully, so we will be able to explain this to our patient. Then we would look at the next, being proficient into the adrenal tumor competency. But we need to be competent first, plus we need to have this other criteria to demonstrate that we are proficient. And let's take another example. Another one is demonstrates the ability To explain to the patient diagnosed with adrenal incidentalomas the tests that are required to establish whether it is a functioning or non-functioning tumor. So in our local guideline, where I work, this is the pathway of how we look after these patients. We receive referral, then we categorize them accordingly, according to their presentation. Then the patients will come and see me for their adrenal workup. Adrenal workup involves baseline blood tests and urine tests, as seen in the screen. One of the tests is what we call overnight dexamethasone suppression test. Remember what I mentioned earlier, competency number 4, dynamic function testing. That is one other competency that we need to be aware of when we're dealing with benign adrenal tumors. Overnight dexamethasone suppression test will be able, hopefully, to explain to the patient how the test is done, what the patient needs to do, explain the proper timing of the test, and when the result comes, we'll be able to explain to the patient the result of the test and what is it means and its implication to their health. The third, the last but not the least, is being an expert. Being an expert, you need to be you have met the criteria for being a competent, proficient endocrine nurse in order to be called an expert. And there are other criteria again that you need to follow or achieve in order to be called an expert in dealing with benign adrenal tumors. An example for that is developing and running a nurse-led service to investigate patients with adrenal incidentalomas. My apologies for this very busy slide, but if you want to learn more about the benign adrenal incidentalomas, I made a webinar with the Society for Endocrinology, and you can access this through their website. And this is what an endocrine nurse will do when they see the patient initially for investigation. Now we've discussed what the adult competency is. We've discussed about the utilization of the framework. Now what we need to do now is, what are the evidences that we can say to prove or show to prove that we achieved our competencies? Okay, so first thing is that you have written a journal about it. You write a journal, you do a reflective practice about what you've done. For example, you've seen a patient to do investigation, adrenal workup. You've reviewed the result, the patient adrenaline level came up elevated. Okay, so you presume that the patient had pheochromocytoma. So you can do a reflective practice. What is pheochromocytoma? What are the management, gold standard management for pheochromocytoma, and how are you going to monitor and check, observe this patient pre-surgery, for example? So you can write that in your journal. How do you feel about looking after patients like pheochromocytoma, knowing that it is a very rare condition that not everybody know or not everybody will understand. And you can do that through writing a journal. Second is, you can either prepare a poster or an abstract, which you can show in any local or international endocrine meetings. Or a direct observation. You may want your manager or your supervisor or your mentor to observe you discussing these things with your patient. By doing so, they will be able to see how you're managing, explaining it to the patient, and be able to give you feedback on how to improve it better. Another is a 360 feedback. 360 feedback is a very good way of getting feedback from colleagues. It may be, any person or any staff that you deal with, either doctors, healthcare assistant, endocrine nurses, or whoever that you deal with in looking after your patients. And this can be discussed during your appraisal or your PDR. or doing a case presentation in either local or international conferences, as well as attending conferences or meetings locally or internationally. In our trust, we are expected to present 3 learning outcomes every time we attend conferences. In doing so, we are able to share what we've learned to our colleagues who were not able to attend the conference, who stayed behind to look after our patients. And these are just examples of evidences that you can share to support your competency. Okay, so now you've got your evidences. How are you be able to achieve all of this? Of course, you need your support from probably doctors, from senior staff, from your manager, from your line manager. Because some of us probably are under managers who are not endocrine. So these examples may be able to help you achieve these competencies. One is clinical supervision. Clinical supervision is usually one-to-one with either your manager or your supervisor or your mentor. In this way, you can discuss the progress of how you're getting on in achieving your competency. What are, if you remember about the SWOT analysis that I mentioned earlier, what are the possible threats? Are you being given protected time to study? Are you being allocated a dedicated job plan to study? So these are the things that you can potentially discuss in your clinical supervision. Another one, I think I've already mentioned this earlier, is a dedicated job plan. Dedicated job plan that is allocated already a time for you to study or to complete your competencies. Protected, meaning to say that that is already available for you to use and it should not be touched. Unless, of course, service requires urgently that you can let go of that protected time, but you should be given an allocated time to study, or if you want to do an audit, for example, or if you need to attend conferences or meetings. Mentorship. I've been mentioning to you about mentorship, mentee-mentor relationship. It's very important, especially for lone workers. They might be working on their own without any direct supervision.
So,
And it should not be touched. Unless, of course, service requires urgently that you can let go of that protected time, but you should be given an allocated time to study, or if you want to do an audit, for example, or if you need to attend conferences or meetings. Mentorship. I've been mentioning to you about mentorship, mentee-mentor relationship. It's very important, especially for lone workers. They might be working on their own without any direct supervision from senior staff. So as I mentioned earlier as well, virtual meetings might be available, and reach out with senior nurses, senior endocrine nurses who might be able to help you with their expertise. One more thing is clear standing operating procedure, or clear pathways, or clear templates. This will help especially if you are new into the post, for example. If you are new in dealing with patients with benign adrenal tumors, having a clear pathway will be a great help because this will guide you. It will lessen confusion. It makes sure that there's no your role is clear and they know what is expected of you. Your senior staff or your doctors know what is expected of you. And last but not the least is signposting. Signposting means to say that to senior staff, doctors, or any members of probably the society will be able to signpost you any available training, any available resources, any available research or publications that might be available for you to study. You can go and visit the Society for Endocrinology website. In the nurses section, there's a lot of information in there that will be able to help you support. Okay, so in summary, overview of the Society for Endocrinology Competency Framework, benign competency number 2, benign adrenal tumor. It's not an exhaustive list, but it is a very important list for you to guide you in order to achieve this competency. And how to utilize the competency framework, we've discussed about SWOT analysis, mentee-mentor relationship, mapping learning needs, appraisal, and learning contract. And what evidences of competency that you need in order to support your competency. We've discussed about reflective practice, direct observation, 360 feedback, attending meetings, sharing your audit, for example, through abstract and poster making or case presentation. And what support needed to achieve this competency? We've discussed about this mentorship, clear SOPs, dedicated job plan, clinical supervision, and signposting. And of course, we need to take into consideration as well our role as endocrine nurses in looking after patients with benign adrenal tumors. We need to take into consideration that we look after these patients from the first time that we see them when we organize their adrenal workup, monitoring, diagnosis, and management. You need to take into consideration as well their psychological health. Okay, many thanks for listening to my talk, and I hope that this has been, or it will be helpful for you to achieve your competency. Many thanks to the European Society of Endocrinology and the Society for Endocrinology for all the information that is available for us. Many thanks as well to the adrenal team at Queen Elizabeth Hospital, Birmingham, and Society for Endocrinology Nurse Committee, and the European Society of Endocrinology. I'm now ready to accept any questions if you have any. Thank you very much.
Thank you very much, Miriam. Can you hear us?
Hello?
Hi,
Yes, I
Miriam.
can hear you. Can you see me?
Thank you very much for the excellent talk. So, is there any questions from the audience? I have no questions from the audience.
Thank you very much for having me today. And
Thank you.
apologies, I have to record my talk because my signal is not great here.